In 1865, a doctor died in an insane asylum. He'd been dragged there by his own colleagues, beaten by the guards, and 2 weeks later, he was dead from an infected wound. Here's the part that should stop you cold. The infection that killed him was the exact same disease he had spent his entire career trying to stop other people from dying of. He wasn't crazy. He wasn't wrong. He was just early. And he's not the only one. Over the next few minutes, I'm going to show you 3 doctors who were mocked, sabotaged, or locked away for being right before anyone was ready to believe them. One of them died for it. One of them nearly lost the fight to a pharmaceutical company. And one of them is the reason your baby, or you if you were born in a hospital, got checked within 60 seconds of being born. There's a pattern in medicine that keeps repeating. The people who move medicine forward the most are, almost every time, punished for it first. Let's find out why. Vienna, 1846. There are 2 maternity wards in the same hospital, right next to each other. One is run by doctors and medical students, the other by midwives. And for years, something impossible is happening. Women are dying in the doctor's ward at nearly 3 times the rate they're dying in the midwives' ward. Same hospital, same disease, something called childbed fever. Same city, same air, same conditions. So why would the ward with more medical training have more deaths? It got so bad that women begged not to be assigned to the doctor's ward. Some of them chose to give birth in the street outside the hospital, rather than go inside. Because a woman who delivered in the street, with no doctor at all, had a better chance of surviving than the ones who walked in the front door. The doctors were the danger. A young Hungarian physician named Ignaz Semmelweis became obsessed with figuring out why. He ruled out overcrowding. He ruled out ventilation. He ruled out religious rites, table position, everything the hospital tried. Then a colleague of his died. The man had been performing autopsies, accidentally cut his own hand with a scalpel during one, and died with symptoms identical to the women dying of childbed fever. That was the piece Semmelweis needed. The doctors and students in his ward were coming straight from the autopsy room, dissecting corpses, and walking directly into the delivery room to examine living patients. No hand washing in between. None. The midwives never touched a corpse. That was the whole difference. In May 1847, Semmelweis ordered every doctor and student to wash their hands in a chlorinated lime solution before touching a patient. No exceptions. The results were almost immediate. Mortality in his ward collapsed to roughly the same low rate as the midwives' ward next door. He had just saved an enormous number of lives with a bucket of chemical solution and a sink. And his colleagues hated it. Because here's the problem. Germ theory didn't exist yet. Nobody knew why washing hands worked. Semmelweis couldn't explain the mechanism. He could only point at the results. And to 19th century doctors, being told, "Wash your hands, you're carrying death on them," wasn't just inconvenient. It was insulting. It implied they, gentlemen, professionals, were the ones killing their patients. So instead of adopting it, the medical establishment mocked him. He lost his position. For over a decade, he kept fighting, kept publishing, kept trying to force the profession to listen. It broke him. By 1865, his mental health had deteriorated badly. His own colleagues tricked him into visiting what he thought was a routine facility and had him committed to an asylum. He realized what was happening and tried to leave. The guards beat him for it. 2 weeks later, he was dead, killed by an infected wound, the same disease, puerperal fever, that he'd spent his life trying to stop. It would take Louis Pasteur's germ theory more than a decade later to finally prove Semmelweis had been right all along. He never got to hear it. You'd think medicine would learn from that it would never again ignore a warning just because the person raising it was inconvenient. It almost happened again, except this time, the warning came in time. Barely. In the early 1960s, doctors across Europe started noticing something they couldn't explain. Babies were being born with shortened arms, missing hands, limbs that looked almost like flippers. Then more, then hundreds, then thousands. Nobody knew why, not at first. But months earlier, on the other side of the Atlantic, a brand new reviewer at the U.S. Food and Drug Administration had already quietly refused to approve the exact drug that was causing it. Here's how she saw it coming, before anyone else did. Frances Kelsey has just started her first month on the job. One of the very first applications on her desk? A drug called thalidomide, already being sold across Europe as a sedative, and marketed specifically to pregnant women for morning sickness. Doctors overseas are calling it a miracle. Gentle, effective, no side effects. Under FDA rules at the time, she has 60 days. If she doesn't reject the application within that window, it's automatically approved. No extension, no override. The clock just runs out and the drug goes to market. She starts reading the safety data. It's thin, rushed, missing exactly the kind of long-term testing a drug like this should have before it goes anywhere near a pregnant woman. Day 58. She rejects it. The clock resets to 0. The manufacturer is furious. This drug is already approved in dozens of countries. They send more paperwork, more reassurances, more pressure, sometimes calling her directly. She's a brand new employee, a woman, in a room full of men who think she's slowing down a wonder drug over nothing. She rejects it again. And the clock resets again. A third time, a fourth time. Every single reset is 60 more days where American mothers are not being prescribed a drug that, unknown to anyone yet, is quietly deforming a generation of babies overseas. She has no proof it's dangerous. Not yet. Just a professional refusal to sign her name to incomplete data. For over a year. Then the reports from Germany and Australia get impossible to ignore. Thalidomide is crossing the placenta and disrupting fetal limb development at the exact stage of pregnancy doctors thought was safe. By the time it's pulled from markets worldwide, more than 10,000 babies have been affected, and close to half of them don't survive. In the United States, because one reviewer refused to sign 4 separate times, the number of cases was around 17. Not 17,000, 17. Kelsey didn't lose her career for this. She didn't die in an asylum. In 1962, President Kennedy personally handed her the highest civilian honor in the country, only the second woman in history to receive it. Same fight as Semmelweis. One person, alone, refusing to give ground to an entire industry. The only difference is, when the world found out she was right, before the damage, instead of after. That timing is the whole difference between a tragedy and a save. And it's about to matter again, in a completely different way. For most of human history, whether a newborn survived its first few minutes of life often came down to nothing more than which doctor happened to be in the room, and how good their gut instinct was that day. No test, no standard, no checklist. If a baby came out limp, blue, silent, one doctor might call it an emergency. Another might call it hopeless and move on. Same baby, same condition, 2 completely different outcomes, depending entirely on who was standing there. One woman decided that was unacceptable and fixed it in a single afternoon of thinking. Virginia Apgar was an anesthesiologist, a woman who'd been steered away from surgery years earlier because a mentor flatly told her a woman couldn't make it in that field. She ended up in anesthesiology instead, and spent years studying exactly how the drugs given to mothers during labor were affecting their newborns. She kept watching the same thing happen. Skilled, trained people freezing in that first critical minute after birth, unsure how serious the situation actually was, with no shared language to describe it. So, in 1952, she built something almost embarrassingly simple: a 5-part score. Heart rate, breathing, muscle tone, reflex response, color. Score each one 0, 1, or 2. Run it at 1 minute after birth and again at 5. A nurse with zero special training could complete it in under 60 seconds and instantly know, is this baby fine, or does this baby need help right now? No committee to convince, no decade-long fight with a hostile medical establishment, no pharmaceutical company to outlast. Just a scorecard so obviously useful that hospitals adopted it almost immediately. It's still called the APGAR score today, partly because her name conveniently spells out the categories: appearance, pulse, grimace, activity, respiration. It helped create an entirely new medical specialty, neonatology, built around treating newborns as patients in their own right, not just an afterthought to the mother's delivery. If you were born in a hospital, at some point in your first 5 minutes of life, someone scored you on this exact scale. So was almost every baby born on Earth in the last 70 years. No asylum, no fight with a pharmaceutical giant. Just a 5-part checklist that quietly became one of the most used medical tools in human history. It's tempting to look at these 3 stories and conclude that medicine is just slow to accept good evidence. That's the easy lesson. It's also not quite true. Look again at what actually got punished in each case. Semmelweis wasn't attacked for being wrong. He was attacked for implying that the doctors themselves were the ones killing their patients. Kelsey wasn't pressured because her data was bad. She was pressured because a company had money riding on her saying yes. APGAR, notice, faced almost none of this. Her checklist didn't accuse anyone of anything. It didn't cost a company a product launch. It didn't imply the doctors in the room had been doing it wrong for decades. It just helped. That's the actual pattern. Medicine doesn't reject good evidence because it's unconvincing. It resists evidence when accepting it means admitting that someone in power was the problem. The doctors who got destroyed weren't the ones who were wrong. They were the ones who made someone else's mistake impossible to ignore. Semmelweis paid for that with his life. Kelsey nearly paid for it with her career and got a medal instead, purely because the disaster hadn't hit American soil yet. APGAR never had to pay at all because her discovery didn't put a target on anyone's back. So the next time someone tells you the evidence just needs to be strong enough to be believed, ask who would have to be wrong for it to be true. That's usually the real reason it takes so long. If you want the next one of these, the doctors who tested cures on their own bodies, some of whom didn't survive it, let me know in the comments, and I'll make that video next.